Good evening, everyone. As he stated, my name is Abigail Greaves. I'm the respiratory educator here at Lakeland Health. And I don't know how many of you have COPD or how many of you have loved ones that have COPD, or maybe you just came in to learn more about the disease itself. Whatever brought you in today, I'm very happy that you're here, and I'm excited for us to spend this time together to learn more about this disease. So first, I wanted to talk about what normal pulmonary anatomy and physiology looks like, and that's really a mouthful. And what it really means is, we'll break it down word for word. Pulmonary means lungs. Anatomy is the actual bodily structure. And physiology means how it works and what it does. So we're going to look at the normal lung structures and how it works. So first I want to talk about oxygen. Can you guys see okay? Okay, good. So first I want to talk about oxygen, and I'm sure we all know it's very important and we need it to survive. Every cell in the body needs oxygen, and we need it for different things. We need it to produce energy to grow. We need, the cells need the oxygen to repair and to replace itself. And we also need it to maintain vital functions, vital bodily functions. When we receive oxygen, when our body breathes in the oxygen, we need it in a certain way. It needs to be delivered in a right way. It needs to be delivered clean. We need our oxygen clean, so we shouldn't be breathing air in that has irritants in it, that's polluted. We need to make sure that the oxygen is the correct temperature. So we don't want to breathe in air that's too hot or too cold, because that can really irritate our lungs. We also need to make sure that when we're breathing in oxygen, it's humidified. So a common question could be, okay, well, you and I are breathing oxygen right now, but I don't have some water hooked up to it, and it's not humidified. But actually, your nose works as a natural humidifier. So your nose works it works to warm, filter, and humidify the air that you breathe. Also, when we're breathing in oxygen, we want to make sure we're breathing in the right amount. So for some of you that may have come to the hospital or have loved ones that have come to the hospital, if your oxygen is too low, we want to make sure that we give you enough. We want to give you the right amount, because you and I right now, if you're not having any supplemental oxygen, meaning you're not having a nasal cannula or a mask on you that's hooked up to oxygen, if you are breathing just room air right now, like I'm breathing in oxygen, I'm breathing 21% of oxygen. That's how much oxygen. But let's say that I don't have enough oxygen in my tissues. So maybe I look a little blue, a little pale. I don't have enough oxygen. I need to, usually if you come to the hospital and if you don't have enough oxygen in your tissue, we would supply you with more oxygen. But we need to give you the right amount. So we're not going to give you too little, because if we give you too little, or if we continue to let you not have enough oxygen in your tissues, then you're not getting enough oxygen to your lungs, to your blood, to your brain. If we give you too much oxygen, that could lead to oxygen toxicity. And that just means, because oxygen is a drug, that just means we're giving you too much oxygen. And I'll talk about it a little later, but for people who have COPD, too much oxygen can be bad, because that can make you more drowsy, more sleepy. It could actually knock out your drive to breathe. So I want to talk about the respiratory system a little bit more, and I'm going to actually show you guys some models so you can see it up close. But here is the respiratory system. We talked a little bit about the nasal passages and the functions that the nose performs to be able to breathe in that oxygen. So when you breathe in that oxygen, or you breathe in the air, it actually comes down lower into your respiratory system. This right over here is your trachea. That's very important. Commonly, you hear it as the windpipe, as my windpipe, and that's where your air passes through. And it goes through this channel and it goes down to your lung. So this would be your right lung, and this would be your left lung, okay? So right over here, you can see that there are two main bronchus. Those are the airways, okay? And this right here is your upper airways. As you go further along, you'll notice that there are your lower airways right over here. And I don't know how many of you guys can see in your model, you'll see it even closer, but these little air sacs right over here is called alveoli, and that's also very important. It's your lower part of your lung, and those are your air sacs. The reason I'm telling you this and showing you the respiratory system is because as we talk more about COPD, it will make sense to kind of put it together, and you'll have a better visual of it. This is another diagram that shows when you're breathing in air, where that air passes through. So if you follow the green arrows, this is when the patient is breathing in their oxygen, their air is coming through, like I said earlier, your trachea, your nasal passages or your mouth, and it goes through your trachea, and then it goes through your lungs. Then it goes and follows through your heart, and it also, that oxygen goes to your brain. So the respiratory system and the central nervous system, those are two systems in the body, are very closely linked, and they both need oxygen for the person to survive. So this is another diagram of, it shows you a little bit about the diaphragm and how important it is. When someone breathes in air, you'll notice that the rib cage expands. So when I take a deep breath, my rib cage expands, and the diaphragm, which is the major muscle of the major muscle that is used to breathe, the diaphragm actually contracts and it moves down. So as I take a deep breath in, my diaphragm moves down. When I take a deep breath out, when I exhale, my diaphragm actually moves up while my rib cage contracts. So I take a deep breath in, my chest expands and my diaphragm moves down. I take a deep breath out and my diaphragm relaxes, moves up, and my chest cavity contracts. It gets smaller. And I wanted to pass this around so you guys can take a better look. And you can pass it around if you'd like. It just shows you the normal lung and what a COPD lung looks like, normal airways, and how a COPD airway looks like. And we'll talk about it a little bit more. So why is the respiratory system important? We've already talked a lot about this. The respiratory system is really important because it has a huge impact on the body. We need oxygen for our cells. We need oxygen for our organs to be able to survive. The respiratory system allows you to breathe in that oxygen, allows you to breathe in that air. And also, if you have any disease in your lungs, it can lead to disease or damage to your other organs. So it's important to understand the respiratory system. So let's talk about COPD. What is COPD? COPD is chronic obstructive pulmonary disease. What exactly does that mean? We'll break it down. Chronic, that means it's long term. If you or I are diagnosed with COPD, that does mean that we're gonna have it, we will have it for the rest of our lives. COPD means that it is chronic. However, as we'll talk about it, even though we have COPD, there are ways to improve your daily activities and still live a happy life, just being aware of your disease process and what you need to do. O is for obstructive. COPD is an obstructive disease, and that just means that there are airflow blockages. So when you take a deep breath in, usually that's not the problem for people with COPD, but breathing out is usually the issue. So we're able to get the air in, but we're having a really hard time getting that air out. And that's because there is a block, there's an obstructive component there. P is pulmonary, which, as we talked about earlier, means the lungs. So it's a disease of the lungs. And then D, of course, for disease. So usually when people think about COPD, we have images of our head of what it is, but it's not always, COPD for one person might not mean the same thing for another person. Each person is very unique in their disease process. Like I stated earlier, it's a chronic respiratory disease, but it also is a group of varying diseases. And this includes emphysema, chronic bronchitis, and sometimes it also can include asthma. So what causes COPD? Is there any guess what the number one cause of COPD is? So smoking, the cigarette. Yep, smoking is usually the number one cause for COPD, that tobacco smoke. There are also other causes, other common causes. Tobacco is number one, but also if you have air pollutants in the home or in the workplace, that can also cause COPD, especially if you are inhaling that long term. Genetic factors, this is not as common, but it can happen that because of genetic factors, you can get COPD. Also, respiratory infections, if you have this long term, it can cause COPD. Who has COPD? COPD is very common. Right now, 15.7 million Americans, which is 6.4% of the population, has COPD, and this is from the CDC. It's also the third leading cause of death in the United States. This is the list. I'm not going to go point by point, but this is the list of people who are most likely to report COPD. What are the effects? Like I said earlier, COPD is not if I have COPD, what I suffer from specifically or some of my activity limitations might be different from the next person. So sometimes the signs and symptoms and also the effects of COPD can be different from person to person. So effects of COPD, and these are the most common ones. Of course, it might not be for everyone, but some of the common ones is activity limitations. And that just might mean that if you are gardening, and usually you were doing it in the past for 3 hours straight and had no problem, sometimes when you have COPD, or if you have a COPD exacerbation, you might only be able to garden for half an hour, and then you'll find yourself having to take a couple of breaks before you start up again. Sometimes it means that you're not able to go to work, or if you are working, you can only work for a certain number of hours. Let's say if you used to work 8 hours a day, no problem, and then now you might have to cut back to 6 or 4 hours a day. Sometimes, like we talked about, when they do your oxygen check and your oxygen saturation, which is the oxygen in your tissues, if that's lower than the physician would want it to be, they may prescribe home oxygen for you, and that could be an effect of it. Also, when you have COPD or really any chronic disease for a long time, sometimes that can take an emotional toll on someone. It could take an emotional toll on anyone, or a mental toll on someone in terms of depression or anxiety. So that could also be an effect. Like I was stating earlier, if we're not getting enough oxygen to the brain, it can have some effects. And an effect can be confusion or memory loss. We're not getting enough oxygen to the brain, so we might have some effects there, mental effects. Also, increased ER visits or hospital admissions or readmissions. Sometimes when we can't get our COPD exacerbations under control, then we might have to go to the ER a little bit more, or come to the hospital a little bit more. So that's why we're going to talk about it in a little bit on ways to kind of control your work of breathing. Like I said, activity limitations can also take effect, such as shortening your time when you go eat out or you go and hang out with friends and family. Okay, COPD treatment. So there's not a cure, but there is treatment to help to relieve some of the symptoms. So the number one, which I'm sure you can see in red, is smoking cessation. This is a big thing. If someone, whether it's you or someone you love or someone you know, has COPD and they're smoking, smoking cessation will go a very long way in relieving the symptoms that you have. It will help to decrease your work of breathing. So smoking cessation is big, and I'll talk about some of the resources because quitting smoking is difficult to do, and there are some resources that we'll talk about to help with that. Pulmonary rehab is another way to help to relieve your symptoms, and pulmonary rehabilitation clinic, that is when people with COPD or any type of chronic lung disorder, they come to the pulmonary rehab, and there's educational sessions such as like the one I'm doing right now. There are educational sessions. Usually they'll do it twice a week. And there's also an exercise component where you can go on the treadmill or whichever exercise equipment, and while there's a healthcare practitioner there monitoring your vitals and helping you along the way. So getting that exercise in and getting that educational information really helps to decrease some of the symptoms and alleviate some of the work of breathing. Flu vaccination, getting that annually is a big thing, because if you have COPD and then you get the flu on top of that, is really gonna increase your work of breathing. It's going to give you more COPD exacerbations. So preventing the flu as much as possible by getting the flu vaccine and washing your hands is a big thing. Also, like I stated earlier, supplemental O2. Sometimes you might just have chronic low oxygen, and it might be even lower than it needs to be. And so your doctor might prescribe home O2, and that can really help to treat your symptoms. So let's talk about the disease process of COPD. Emphysema and chronic bronchitis are the two most common conditions that contribute to COPD. Chronic bronchitis is the inflammation, and on the model you'll see the airways. There's inflammation along the airway, lots of inflammation, and it's a chronic inflammation. So if we imagine that this is the airway, this would be a normal airway, you could imagine that this would swell and there will be lots of inflammation along the airway. So that would decrease the amount of air that can go in and out of the lungs. Also, is characterized by excessive cough and mucus. Emphysema is also a condition that's characterized, that's grouped into the COPD bracket, and it just means that the smaller airways have been damaged. Usually is by cigarette smoke, but it can also be from toxic air. So this would be the normal alveoli, like we talked about earlier, those air sacs at the bottom parts of the lung. They start to look like this. So they start to become very damaged. And it also, so that of course makes it harder to breathe, because with the alveoli, there's lots of room for air exchange. But with the alveoli and emphysema, it's a lot more swollen, and they're damaged, so not as much air can go in and out. So let's talk about breathing strategies. Let me just grab this chair. So with when you have a hard time breathing, so let's say that situation I said earlier, if you are gardening and you want to be gardening for a little longer, but you notice that you're having a difficulty time breathing, there are some exercises that you can do to help you get over that hump and help you breathe a little easier so you can continue your activity. A common one is pursed lip breathing. How many of you guys have heard of pursed lip breathing before? Okay, there are a couple of people, that's good. So pursed lip breathing is a common breathing strategy that can really help decrease your work of breathing. So what you would do, and I'm going to ask each of us to do this together. You're going to sit down, relax your shoulders, and I think, I have all the points here. You want to relax your shoulders, and you want to take a deep breath through your nose for about 2 seconds. Then pucker your lips like you're going to blow out candles, and I want you to blow very slowly out. You want to breathe out about 2 to 3 times longer than you breathed in. So if you take a deep breath in for 2 seconds, you want to exhale out for about 4 to 6 seconds. So that can be hard to do if you're having difficulty breathing already. So if I'm having a difficult time breathing, usually I'm breathing fast, like, and then I'm telling you to breathe slowly, like, you're like, Abby, obviously I would breathe slowly if I could. But you want to really kind of mentally tell yourself, if I can breathe slowly now, I can decrease my work of breathing in the long run. So you want to do it again. I'm going to have us all do it together. Remember to take a deep breath in for 2 seconds, then breathe out for 4 to 6 seconds, okay? So let's take a deep breath in and blow out. Good. And what that's doing is the key thing is you want to have the pursed lips. You want to pucker your lips and do a pursed lips. What that is doing is causing some pressure, some resistance, and it's forcing that air out. So a lot of times with COPD, you'll have lots of air that's trapped. Remember I was saying in the beginning that COPD is an obstructive component? That means we have a great time breathing in, no problem. But breathing out is our problem. So when you do pursed lip breathing, it forces that air out. A lot of times you'll notice with those of us that may have COPD, we'll have sometimes barrel chest because we have a lot of trapped air in there. So doing pursed lip breathing, doing that exercise helps to really get that air out, that stale air out. So this is a picture again of how you would do the pursed lip breathing. So for diaphragmatic breathing, this is another way to kind of control your breathing if you're having an exacerbation, if you're having some difficulty breathing. It's another exercise that you can do. This one is not as common, and when we talk to our patients, they say they don't like it as much, that they find more benefit with the pursed lip breathing rather than the diaphragmatic breathing. What you would do for the diaphragmatic breathing is you would take a deep breath in, and when you breathe out, you would press your belly. And that also has the same effect of getting that trapped air out. So let's try it all together. Let's take a deep breath in, press your belly and breathe out. And if you're having difficulty breathing, that should also help to get some of that trapped air out. Of course, there might be times when this doesn't work and you may need a little bit more help, and we're going to talk about that in a little bit. But diaphragmatic breathing, again, is not as easy as pursed lip breathing, but you can try that if you're having some difficulty. This is just a picture of it again. So when you're inhaling, your ribs are moving upward and outward like we talked about. The diaphragm is the main muscle when you breathe. So that is going to move down, and then when you exhale, your diaphragm is going to rise. And your chest, your ribs should actually go in. And again, that's where we usually have a hard time with COPD. That air gets trapped there. So when you do diaphragmatic breathing and we push in that belly, then some more of the air can come out. Secretion clearance. Secretion clearance is also very important in managing your COPD and trying to improve your daily functions and your daily activities. Secretion clearance, what it really is just getting that mucus out. So a lot of times with COPD, you'll have excessive amounts of mucus. And when you get difficulty breathing, you'll have even more mucus than usual. So it's important to get that mucus out. So positive expiratory pressure therapy, PEP therapy, is a really great tool because, and we give this to our patients here at Lakeland, because what it does, it helps to open up the airways and remove that mucus. It has some pressure and vibrations in the device. So you take a deep breath in, you put your mouth on the mouthpiece, and you blow out. When you do that, it has like this windmill effect that provides some pressure. And what it does, it vibrates the bottom parts of your lung. Remember we were talking about the alveoli? And that a lot of times with COPD or when you get really sick, you can get mucus stuck in that alveoli in the lower parts of your lungs. So PEP therapy helps to vibrate that mucus and helps to move it up to the upper airway so it's easier to cough out. This is a picture of coughing. So usually we'll do that PEP therapy and then we'll do we'll have someone cough afterwards. Of course, I'm sure we all know how to cough. Sometimes we have trouble not coughing, but this is a picture of someone coughing. And what it usually is, and if it's not on demand, like if I'm not asking you to cough and you're just doing it involuntarily, there's usually some type of irritation in the lungs or in the airway that's causing you to want to cough. Then you take a deep breath, you compress your airway, and then you cough out that mucus. So let's test our knowledge. I'm going to ask you guys to participate. I think we have a good-sized group here. I want to ask you guys something. Your bronchodilator, so that's your albuterol, your Atrovent, your inhalers. Is it better to use that before you do a secretion clearance technique like we talked about, or is it better to do it after? Any ideas? Before. Yeah, very good. It's better to do it before. And the reason is because you want to open up that airway. You want to make sure it's completely open so you can better cough out that mucus. Also, when you do like the PEP therapy or when you're coughing a lot, you can actually make your airways more constricted, meaning your airways are going to tighten up more. So if we use the albuterol or the Atrovent, whatever your doctor has prescribed before, we can actually usually prevent your airways from being constricted after all of that secretion clearance. Does that make sense? So we want to do that before. So other than the PEP therapy, are there any other devices that you can think of to help move that mucus out? Yes, that's a good one. Steam. Steam is a good one. Steam is a good one. That can also help to get that mucus out. Yeah. There's also things called acapella, which is really a flutter device. And those type of devices are the same thing. It helps to move that mucus from the lower airways up to the upper airways so you can better cough them out. And why is this beneficial for reducing admissions to the hospital? And I just so I can help you guys out with this one, even though I'm sure some of you guys might know, it's really great to reduce admissions because if you keep that mucus in your lungs, it can cause an infection, pneumonia or some type of other infection. So it's important to get them out as best as you can. So coughing is really actually a great thing. If you can cough and get that mucus out, that's good, because if it stays in your lungs, usually you get that infection and then you'll have to be admitted to the hospital. Good. So we talked about goals of secretion removal. Also I want to talk about another goal is when you get that mucus out of your airways. So imagine if this is our airways and it's completely filled of mucus, not too much air can go in and out, right? Because it's filled with mucus. If we can get that mucus out, we'll have a better time breathing because more air can come in and out. So cough technique. So a deep breath is followed by a forced exhalation. That's really the definition of a cough. So we have some different cough techniques, and this is called a huff cough. Has anyone heard of this before? Huff cough? Okay. One or two people have heard of it. That's good. So huff cough, if you're having a hard time, you can cough, but you can't get a deep cough for different reasons. A huff cough is good because it can help you get that lower, the mucus out of your lower airways. So what you would do is just like this lady is doing in the picture, is you want to sit with your chin slightly upward, and the reason is because you want to have your airway nice and open. And you want to use your diaphragm, which is the major muscle for breathing, right? You hold your breath for 2 to 3 seconds, and then when you exhale, you actually, do you remember that picture where you compress your airway to cough? We're actually going to not do that. We're actually going to keep our airway open, and you're going to huff cough. So what you do is, instead of coughing like, you're going to go, and that actually is supposed to also remove the secretions from the lower parts of your lungs. So we also have vest devices we've seen in the community, and some people have it at home. What it does is, just like the man has in the picture, it's a vest, and those tubes are hooked up to a machine. That machine actually pushes air, like little jets, and it vibrates all around your chest, your back, and that also, same thing. It helps to loosen up that mucus. It helps to vibrate your lungs, loosen it up. So after that, you can cough. These are different cough techniques, so you can choose which one works best for you. So volume building cough. So that is the one where you would do multiple inspirations to build up the volume behind the cough. So you'd go, and then cough, okay? So take lots of deep breaths and then cough. So you have a bigger and stronger cough at the end. The multiple cough technique is where you will cough multiple times during one exhalation. So you would take a deep breath and then go. Then you have a serial cough technique. And when you do a serial cough technique is you start with a small breath in and then cough. And then take another bigger breath and then a deeper cough. And you keep on taking a bigger breath and a deeper cough. Bigger breath, deeper cough. And that's called the serial cough technique. Again, all of this is to help with your, to remove secretions, which is mucus. You want to remove the mucus. So like I was saying earlier, sometimes it's difficult to cough, and that's why people need the cough techniques. And sometimes you might have difficulty coughing because I don't know how many of you have had cardiac surgery, but when you have cardiac surgery, it can be very painful to take a deep breath, extremely painful. So sometimes you need, I don't know if you guys have had, if anyone has had a surgery here, but we'll give you like a pillow or a red heart pillow, and we use that to help splint. We'll call it a splint, and you would have either assistant, or if you could do it yourself, you would hold it against your chest or where you feel the most pain. You would take a deep breath and then cough, and that should help to relieve some pain. Sometimes you need some more pain medication, but this can also help, and that's the splinting, just like they're doing in this picture. And we already talked about percussion, and now we're talking about vibration. Vibration is if you take a deep breath and then someone, usually it's a healthcare professional or maybe even a family member, if maybe you had an x-ray and they said that you have lots of mucus in the right side of your lung. If you have lots of mucus, you'll have someone come, if you pretend this is my back, the right side of my back, you'll have someone press down and shake. They're vibrating that, and they're helping to loosen up those secretions. There's also postural drainage, and let's say that same situation, if someone has a lot of mucus in their right lungs, like maybe they had pneumonia, and they have a lot of mucus in their right lung, what you're going to do is you're going to have that person lay down on their left side, right side up, and that will help to drain that mucus, okay? And actually going back on percussion, what percussion really is you can use the vest that we talked about, or you can also use a cupped hand like this. You could do a family member could do it, or yep, exactly. You could do a family member could do it, or you in the hospital we do it as well. A respiratory therapist would do this, where they would hit alongside your back, either on both sides or wherever the affected side is, and that again is to help loosen up the mucus where the lungs are, where the affected side is. So coupling that with the postural drainage, we'll usually have the person lie on the unaffected side, the affected side up, and then we would do the percussion so that mucus can drain from the lungs back to the upper airway, and then they can cough it out. These are pictures of someone who's in postural drainage. So this person right over here, if they had mucus on one side, which side would it be? Right side. Right side, yes, right side. So it would be their affected side up. So it would usually be their right side. Good. So early recognition and treatment of exacerbations. So I said exacerbations before. What does it mean? Does anyone know what it means? Difficulty breathing. Yep. So it's really just you have a difficult time breathing. But with COPD, that might be chronically. But with an exacerbation, that means you're having more more of a difficult time breathing than you usually do. So that's what an exacerbation means. So what signs and symptoms do you think might indicate that you're having a hard time breathing, or might seem that you're having a hard time breathing? Anything that you can think of? Shortness of breath, exactly. Yep. Coughing. Sometimes if you're breathing really fast, that's showing that you're having a hard time breathing. Let's say you usually breathe about 16, 17 times a minute, but you're breathing like 40 times a minute. You can't catch your breath. That's a sign that you're having a hard time breathing, and we need to work on that, whether that means resting or maybe taking your rescue inhaler. And we'll talk about what you can do a little later on, but you want to make sure that you know what specifically for you. Remember I said COPD might be different for each person. Specifically for you, what do your signs and symptoms look like? And what do you do when you do have an exacerbation, when you're having a hard time breathing? How do you handle your bad days? And then what is your current heart rate and respiratory rate? Because if you're having a faster heart rate than normal, a faster respiratory rate, that can really indicate that you're having an exacerbation. Also, are you wheezing more than normal, right? So if your airways are like this, but you're having an exacerbation, that might mean that you're having what we call bronchoconstriction, and that just means your airway is tightening. Your lungs are tightening up, and that really causes that wheezing. Just a little bit of air is passing in and out. Are you having more wheezing than usual? Is your mucus a little bit more than usual? By the way, when you're looking at your mucus, I know it doesn't sound like very much fun to go and kind of just look at your mucus and assess it, but you have to really look at it. What's your color? What's the color like? What's the smell? What's the consistency? Let's say you're usually coughing up clear mucus, but today you're coughing up yellow mucus. That's something that when you go to your doctors, you need to tell them that so that they can they can have a better assessment and know the best course of treatment for you. Are you more sleepy and confused than usual? Because your oxygen might be a little lower than it usually is. You might not be getting enough oxygen to the brain. Or we have something called carbon dioxide. Maybe your carbon dioxide is higher than usual. Maybe your skin color, you're more pale than you usually are. And this is something you can also tell your family and friends, hey, these are some of the things I want you to look out for me. If you notice some of these things are different than usual, let me know, or I'll talk about our action plans in a little bit, and you have specific actions to take. Do you have a faster heart rate or respiratory rate? It's important to know when you go to the doctors, what is your usual oxygen number? So on your bad day, are you having lower oxygen than usual? And also chest tightness. Are you having some chest tightness? You want to know your numbers, what your baseline is, so that you know what abnormal is. Okay, so how do you check your heart rate? So this is exactly just how this lady is doing it. That's how you would check your heart rate. So you would put your 2 fingers on your wrist, and when you feel your pulse, you count for 30 seconds. You count your pulse, and then you multiply it by 2. If you don't feel like doing the math, that's fine. Just do 60 seconds, and whatever you count your pulse to be, that's what your heart rate is. Record your number and know what your baseline is, and know if your heart rate is increased. How do you check your respiratory rate? Just like they're doing this picture. You want to sit relaxed in a chair. Try to relax if possible. If you're having a difficult time breathing, that's just not going to happen, and that's fine. Still have the person count your respiratory rate for you. I will say, though, if you're breathing fine, many times we'll notice with our patients when we come and they know that we're checking the respiratory rate, just not even on purpose, they're changing their respiratory rate because they know that you're checking. And I do that too. It's just because we know someone's doing that, we're just not even thinking, but we're changing our respiratory rate. So we'll try to hide it, but if you're having a hard time breathing and you're really breathing fast, a lot of times you're not even going to care about it, and you'll be breathing how you would breathe. Okay, so normal oxygen levels is usually 90 to 100 in healthy individuals, but sometimes with COPD, your oxygen might be your low 90s or your high 80s, and your physician might be okay with that. That might be normal for you. But still, even if your physician is okay with you being at 89, it's still important to know that 89 is your baseline, and that if you go lower than that, then you need to follow your action plan. So it's important to talk to your physician about your action plan. In chronic lung disease, again, sometimes a lower O2 oxygen, your lower oxygen number is okay, but you need to really have that conversation with your physician to figure that out. It's important to never titrate your oxygen, meaning don't go up or down on your oxygen without your physician's permission. So if you have oxygen at home, it's important to know what your range is, and don't go above or below that range, because again, for people who have COPD, if you have too much oxygen, it can really knock out your drive to breathe, meaning that you'll start to breathe a lot less, you'll become very sleepy and drowsy. So it's important to know what your range is from your physician, and don't go above or below that range. Some of the best ways to reduce your exacerbations, you want to make sure you hand wash. You want to make sure you wash your hands. And like I said earlier, if you have COPD and then you get a cold on top of that, or flu on top of that, it can be worse for that person than it is for someone who doesn't have COPD. So, every time you leave the grocery store, when you leave, let's say you go for a wellness check at the doctor's office. I mean, the wellness checks is a lot of times you get sick there because of the lobby, But of course, we still want you to go to the doctor's office. Just make sure you wash your hands after you leave. Keep current on your vaccinations. Get a flu shot every year. And if you know that someone in your family or someone you work with is sick, definitely try to avoid being in close quarters with them. COPD action plan is very important, and each one of you in the bag that they gave you in the back has a COPD action plan that you feel free to take. is really important. And so I'm gonna go one by one real quick. This is something that you want to go through every single day, and you want to talk to your physician about what your ranges are, but you want to go through this every single day, and know, am I in the green, am I in the yellow, am I in the red today? Know what your baseline is, and every day know which zone you're in. So the green zone is, I'm doing well. I feel pretty great, and this is how I'm feeling. I'm breathing without any shortness of breath. I'm sleeping great. I'm able to do my normal activities, my gardening. I'm able to take my walks. I have my usual amount of coughing and mucus. So for some people, they might have this chronic cough and mucus, but is that their baseline? And if it is, great, they're in the green zone, or their appetite is good. Because when you're not feeling well, you're not going to have a great appetite. So you want to make sure that you're in the, your appetite is good and that you're in the green zone. So if you're in the green zone, what the action plan is that you want to make sure that you take your medicine as usual. So if your doctor has ordered your maintenance medication, you're still taking that every day. But you also want to make sure you avoid smoke. So you want to avoid anyone who's smoking. You don't want to smoke yourself. You want to avoid fumes and strong smells. You want to avoid your irritants, basically, because let's say in the morning you do your assessment and you're in the green zone, great, but then you get exposed to these things, and then by the end of the day you're in your red zone. So you want to make sure you're in your green zone, but also still follow this action plan. Yellow zone, today you woke up and you don't feel that great. You feel pretty worse. You feel worse than you usually do. You have shortness of breath. You're tired and unable to do your normal activities. You have a high temp. You're coughing up mucus, but it's more than usual. There's a change in color, or it's thicker than usual. And you're having to use your albuterol or your whatever rescue medication you have more often than you usually do. If this is the case, you need to call your doctor. Your doctor is your partner in this. Don't feel like you have to go through this alone. Definitely call your doctor. They're here to help. You woke up one day and you're in your red zone. I am in danger. I feel horrible. I'm short of breath. I'm breathing really fast. Even when I'm at rest, I'm not doing anything and I'm breathing really badly. I have chest pain. I'm confused. I'm coughing up blood. I notice I'm blue or I'm gray. This is a danger zone. Call 911. You don't want to wait. And if you feel like if you're in a danger zone, by the way, you don't want to call 911. You don't want to just drive yourself to the hospital or have someone drive you to the hospital. If you're in the danger zone, call 911 because your EMT can actually come and provide treatment to you where you are. So we've seen cases where people will come and they think that they're okay, that they can handle the drive here, and they have difficulty in the car. And when we could have treated them immediately as soon as we got to your home. So if you're in the danger zone, call 911. And we already talked about the green zone. Yellow zone, of course, again, call your doctor. And red zone, you want to make sure you call 911, okay? So I want to talk about our resources really quickly. So for your resources, smoking, like I said, it is hard to quit, but there are resources. And 1-800-QUIT-NOW is an excellent resource to call, and they can give you some support. For anyone that maybe that's suffering from COPD, or if you're suffering from it yourself and you notice that you're feeling depression and anxiety, talk to your primary care physician about this, and they can help get you the support that you need. We also have Lakeland nutritional counseling because sometimes with COPD exacerbation, it can be brought on, your exacerbations can be brought on your diet. So if you have a diet that's high in carbohydrates, it's taking a lot of energy out of you that could be used to help you with your breathing. So you want to make sure that you get some maybe help with your diet if you think that could be an issue. We also have the Breathe Easier Club, which is a support, and I see one person who usually goes to our Breathe Easier Club was here today, which is good. Our Breathe Easier Club is a support group and an educational group where we talk about these topics. So like one day we'll have a yoga instructor come and say, how can you do exercise while suffering from COPD? Or we'll have a dietitian come and talk about nutritional tips. We also have dinner every time, so feel free to come. It's April through October, the first Tuesday of the month in St. Joe and the first Wednesday of the month in Niles. We also have a Facebook club where we will, it's called the Breathe Easier Facebook Club for Lakeland, and you can come there, and we also have like articles and great tips there as well. So there are some resources here to continually kind of support each other and help, that we can help you with. So Healthline did this great thing where they had different people come, and I like this one, so I posted it. It's, I have COPD, but I'm not going to let this get me down. So I have COPD, but I have an action plan. So I have a plan, I know what I need to do. COPD is not going to completely erase my activities. I'm still gonna do what I like to do, but it's not gonna let me down. I'm just gonna be aware of my disease process and what I need to do. And there are many people who have COPD or any other, any chronic lung diseases or chronic respiratory diseases, but you still can live a good life just understanding where you are in your disease process and what you need to do. This is my family. I'm one of them. This is me right here that has chronic respiratory disease, but as you can see, I also, live my life, do my activities. Just you have to be aware, have your action plan, and know what you need to do to continue your activities. Okay, well, thank you. Are there